welcome. This is Parkinson Power. This meets once a week with lunch. We have wonderful community sponsors that cater lunch for you. It was good, wasn't it? This is the component of what I call your treatment plan. For those of you that don't know me, I've specialized in Parkinson's for almost 20 years. I'm an educator and an advocate and a very strong motivator. All right, I will motivate you. I will get on you, right? And I'm like a bulldog. I will bug you and probably get on your nerves, but I do it because I love you. And nobody has struck me yet, you know? I still get my hugs and kisses. But this is all about empowerment. And it's the fulfillment of the treatment plan that you need. Because, you know, you need your board-certified neurologist to take care of you medically, the clinical side, right? You know, how you doing with the disease process? How you doing with your meds? How you doing, you know, with everything else that goes on with you physically with this disease? But there's a big other component to this disease, and what is it? It's the psychosocial side of it, the emotional side of it. So, you know, whereas physicians have a wonderful role in your life, as do all of the healthcare providers in your life, I always say to these people, well, you know, to the professionals, well, what are these wonderful folks supposed to do when they go home? What do they do when they get in the elevator and get in the car and go home, right? And we're talking about 95% of your life is not lived in the doctor's office. So how do you cope? How do you live? Well, you already have it. So we have that checked off of our list, and we're not going anywhere, right? Keep it up. Yeah, well, we will. We're working on that. But you have to find a way to live well with the disease. And I always say the words, live well with the disease. I don't want you to just exist. I don't want you to just cope. I want you to live with enthusiasm and joy and hopefulness, right? And faith in yourself and faith in each other. And that's not an easy feat, is it? I mean, this, through my eyes, is really the challenge of a lifetime for so many people, because a high percentage of folks that are impacted by Parkinson's are what I call sensational seniors, right? And I added that word sensational. Huh? Because we are in a very exclusive club. Okay, but it affects seniors, which makes it even harder, right, to get through the day with Parkinson's. But Parkinson's really is difficult. It's difficult physically. What makes it difficult physically? What makes it hard for you?
Don't know where you're going to be, high or low, in a given time.
Yeah. From the physical standpoint, we're talking physical now. The physical motor signs and symptoms of Parkinson's. What are they? What are the 4 benchmarks, signs, and symptoms of Parkinson's? Now, remember, I'm up here to motivate you, but I'm up here to educate you as well, because you need to be smarter and stronger than this disease to live well with it, because that puts you in command, that puts you in control. If you are in control, you have power and you have positivity. You with me so far? So what are the 4 benchmark signs and symptoms, physical symptoms of Parkinson's? So that you go to the doc and they say you have 1 of these symptoms or 2 of these symptoms, you got it, okay? Resting tremor. That means resting tremor, and there's 2 kinds of tremor. Resting tremor means you cannot turn it off. You with me? If you're in a time in your cycle that you're going to tremor, you're going to tremor. All right? And there's nothing going to stop you. You have essential tremor as well, and essential tremor means that you only tremor when you move, right? So I'm perfectly calm sitting here like this, but if I want to pick up the water bottle, I would start this, okay? And your tremor is more of a pill rolling initially with your hands, all right? The little pill rolling, shaking from the wrist, all right? So tremor. Now understand you can have one, some, or all of the symptoms. You can go through this whole thing without a tremor. You can go through this whole thing without rigidity. So you got tremor is number one. It's kind of the public realize, oh, they got a tremor. It's probably Parkinson's, all right? So tremor is one. What else you got going on? Bradykinesia, that's a fancy word for what? Slowness of movement. Have you noticed? You're slowing down. You're taking slower steps, but even to pick up the toothbrush, what? We got this, right? It's like somebody slowed down the video, all right? What's wrong with slow? Nothing. You with me so far? So you're slow. So what? Are you still able to pick up the toothbrush and brush your teeth? Well, then do it anyway. So if you're slow, so you're slow. Who cares, all right? But you have very, very, very slow movement, all right? The slowness affects other things down the road. But now you got tremor and you got bradykinesia, which is slow motion. What else you got? It's not one of the 4 benchmarks, but it comes along as part of the package. What's the next one? Come on. Postural instability. Have you noticed when you get tired, you start this and you start this? It's why you're this way, because you're unsteady, because this is a disease of your muscle. And this is a lot to hold up your trunk and to hold up your head and to hold up your shoulders and to swing your arms, right? It's a lot on these legs, you know, to stand up tall and to carry you safely without falling. With me so far? So postural instability means that you're going to sway, you're going to stoop, all right? If I push you, how many of you have been to the neurologist, and as part of the neuro eval that he does for you, they'll come up and they'll give you a little push. And which way are you going to go? Parkinson patients will want to go backwards. If we give you a nudge and there's not somebody ready to hold you, you're going to go, boom, the opposite direction. All right? You lean forward, but if I push you, it's very easy for you to falter backwards. All right? And the last one is what? What happens when you get tight in your muscles? You know you get tight. What's the word I'm looking for? Rigidity. You're rigid. All right? They'll feel you, and they'll feel in here this is tight, or you don't want to, you know, extend or whatever with me. It's tightness. They're your 4 benchmark. They're the 4 that the doc's going to look at, and if you're showing 1 or 2 of them, okay, this is the number 1 criteria for diagnosis. Yes?
Is rigidity all the time?
No. Nothing is all the time. Nothing is all the time. You see, this is what your highs and lows are, your ons and offs are.
The doctor diagnoses it Parkinsonism instead of Parkinson disease, because you have the symptoms, but they're not sure if you have them.
Yeah, there's a difference between, a lot of it has to do with your response to Cinemeds. All right, Parkinson's disease, Parkinsonism, a lower level of symptoms coming in behind it. Yeah, so you can have true Parkinson's or you can have Parkinsonism. And this is why it's very, very important that you're under the care of a board-certified neurologist. If you don't do anything for yourself, be with the right physician. Be with the right physician, because this is a disease that you're going to walk with your doc with this. That you can't have a doc that says, okay, I'm going to see you every 6 months and do your best in between office visits, right? You have to have somebody that is at arm's length or again on the other end of the phone, because you have so many changes day to day, week to week, month to month. You can have so many exacerbations that can really upset you, and you need the resource of a good physician. So it takes more than just board-certified neurology. You know, then there's a lot. This town is full of very fine neurologists, but you want to have one that's passionate or board-certified in Parkinson's, because this is a very distinctive specialty, okay? All right, so, and you're all under the care of a board-certified neurologist? Yeah, you are. Okay, good. You all know we have Dr. Pat Madden here. He's very, very fine. General neurology, very passionate about Parkinson's. His outcomes are very good. He takes very good care of you, and he's very patient and concerned about you, which is what I honor him for. We also have Dr. Juan Sanchez-Ramos. He is world-class, renowned for movement disorders. He's a specialist, fellowship trained. He's here on Wednesday. He's back in town. He was out of the country for 3 weeks, but he has returned to us. So I don't know if he's coming tomorrow or next Thursday. Is he coming? And then we have Ask the Doctor this week with Dr. Juan as well, and I've changed the protocols for that. So remind me to tell you about Ask the Doctor. Okay, so you have these 4 symptoms. How do these symptoms affect your life? How does tremor affect your life? Everything you do. Right? That tremor gets in the way of your dexterity, your ability to do fine motor, your ability to write, to button, to tie, whatever, to cook, to cut, whatever you're doing. How many of you are living with some level of tremor? Okay. And we all know that you have good days and bad days, right? Sometimes it's there, sometimes it's not. All of these symptoms, some days it's there, some days it's not. That's why it's so elusive, all right? We talked over here, somebody mentioned here about the freezing. Freezing is part of the problems with the gaits. And what happens when you freeze? You know what happens when you freeze? You're walking along and all of a sudden you stop, all right? Your brain is saying, move your leg, step over the curb, take a step, all right? But the path from here to here, you're frozen and you stop. We have a member here that will freeze for 10, 15 minutes. And that is, is that you behind the post, girl? I didn't even know you were there. Hi, sweetie girl. This is your highest risk for falls when you're frozen. Why? You can't get yourself out. You're unstable, you're frozen, you can't get yourself out. What happens when you start to stumble? You automatically have a reflex to counteract the fall, right? You'll either do this, or you'll put the other foot out, or you'll do something to keep from going down, but you don't have that ability. Freezing all of a sudden happens. Have any of you frozen? It can be just for a moment, or it can be for a seriously long period of time. We have a member that the other day I clocked, took him over 20 minutes to get from the bistro to the car, and the car was right outside the side door, right here. And the caregiver stood patiently waiting, right? It happens. What are some of the tips to get you out of a freeze?
One thing you want to do if you freeze a lot is have a cane. It gives you a third support.
Well, canes, I have pros and cons with canes, and this is only a Marilyn opinion because I am not a physical therapist. All right, canes have a very small role in the benefits for a Parkinson patient because they don't have what you need to keep you from falling. You never use them right. Most Parkinson patients I see carrying a cane, either carrying it like a purse. I told you my sweet mother was on a cane for about 10 minutes because I kept yelling at her. She used the cane to push the plate that opened the automatic doors outside her assisted living. Other than that, she was swinging it like Charlie Chaplin, And keep the dogs, swat the dogs, all right? The only thing they might do is give you some depth perception. I'd rather see you on walking sticks like Joyce uses for depth perception if you don't realize where the floor is, all right? With the freeze, it most often will happen, say, if we go from one texture to another. Say you go from the carpet to a checkered tile in your kitchen. It'll just be like a barrier for your brain. Doors, jams, anything that shows an obstacle for the brain. So what you want to do is trick your brain. You want to do the opposite of what you're asking to do. So if you have a loved one that's frozen, please don't say, move it, honey. Take a step. Let's go. Let's go. The first conference that I did with Parkinson Research Foundation was at the Polo Grill. Were any of you there with me in those days? It was spring. Well, you've been with me forever, haven't you guys? That was a fun one, wasn't it? That was the September, October of 12. That was a while ago, right? And we had a sweet lady, and she was frozen stiff, and everybody was around her like a bees on honey. Take a step over, sit down, do something, And the poor thing, you could just see, her anxiety because she was frozen. All right? So, everybody was giving her this verbal cue of what to do. So I just walked right up to her and I said, take a step backwards. Take a step backwards. And she took a step backwards and she was fine. Why? We tricked the brain. The brain thinks, I want to walk forward, all right? So when you get into this situation, I had another patient that when he was in the kitchen, he would be rammed against the counter because he loved to make lunch and stuff like that. Well, he would be rammed against the kitchen counter just like he was chained to it because he couldn't get out. Get your kitchen counter. Think about. So I said to him, do the box step. Remember dance class, the box step? Okay? So take a step to the side, and it works like a charm. So trick the brain. You can also count, you can sing, you can do some other function other than forcing your brain on command to walk. Most of us walk without even thinking.
Right.
There's so much that we do in life, don't we? Those of us that aren't personally diagnosed with Parkinson's, that we don't even think about. We don't think about falling down. We don't think about being unable to, button our button. I have a few pieces of jewelry that are challenging me now that somebody has to either put on a magnetic clasp for me or I'm going to throw them away, The button hook, what's that, a button hook? We got a button hook? We should start researching these special little adaptive things. Can you have one? Would you bring that and show it to me? Yeah, because I'm into all these.
You can get them in a medical supply store.
Medical supply store. See, so use adaptive things. Use adaptive things because with the dexterity, the loss of dexterity, you can't do these little things that you want to do. You want to do them. I want you to do them for as long as you can do them. So if you can rely on an adaptive device, all right, you include utensils, anything else you can use to allow you, long shoe horns, anything.
The old-fashioned shoes are around with the little buttons on.
Oh, now you are dating yourself. The pointy ones when women wore a size 4 shoe. Remember when they were little and petite? Uh-huh. And they had 20 buttons up the side and the tights and the petticoats and the... That's a whole other lecture. We could really talk on that one. Yeah.
I've been to this place and I can find out where it was, but they have all these kind of little adaptive things.
Mm-hmm.
You can buy them.
Well, we need to find about that because, for folks that have difficulty with a standard fork or a standard spoon or whatever,
Weber and
Beneva. Beneva.
Weber.
Wonderful. They have a wonderful,
medical department store.
yeah.
Gotcha.
Go in there and tool around because the key is you're going to do it for yourself.
They've got everything from elastic shoelaces to...
I know they do. They've been there for 100 years. They've been there for 100 years. Okay, so the physical part of Parkinson's disease, and then you add on to all the other stuff, the freezing. What else do you see physically with Parkinson's that can impose on you? Speech and swallowing, right?
Lack of sleep.
Speech and swallowing, well, that goes more into the psychological part of it. The masked face, that's a whole conversation about communications and getting your emotions out, all right? The talk today, I think, is on apathy and depression. Apathy and depression. These are two of the signs and symptoms of Parkinson's disease because, there's a laundry list of them. If I were really to sit down and really detail all the signs and symptoms that I've seen with all my Parkinson patients over the years, I think I'm going to start doing that. I would have a list this long, all right? But apathy and depression, depression is actually considered one of the symptoms of Parkinson's, all right? What is depression? What is it? Who knows? A low blue mood. All right, you're down in the dumps. You're down in the dumps. But it's a low mood that lasts for more than a few weeks. And there's really no trigger for it. Right? Now, there's a difference between depression and sadness. All right? You can be sad. Why? What are some reasons that a senior can be sad? Losses. The older that you get, the more at risk you are of losing. You can lose a loved one, which is the most painful thing in the world is to lose someone that you love. It makes you sad. It makes you grieve. All right? What else? What can make you sad? The need to move out of your house that you've been in for 50 years. A lot of seniors will go into a serious state of sadness or underlying depression because they don't want to be, even though that retirement community is the Ritz-Carlton of retirement communities, they don't want it because they want to be in their own bed with their own refrigerator in their own home because of the, what they had their whole life. You can lose a pet. I've had seniors have to go into therapy because they lost a pet, okay? And then on top of that, seniors lose little things along the way, all right, that you don't even realize you're losing that can make you a little bit blue about things.
Memory.
Huh?
Memory.
Well, that's a big one if you start losing your memory. You lose your ability to do things, all right? You might lose your ability to drive. You might lose, you can be sad by what all of a sudden you see in the mirror. I had to get you lighten up here a little bit. Huh?
Favorite sport,
A favorite sport you can't do anymore. Get over it. But the loss of what you could do and what you can do now. So the greatest thing is to focus on how great you are today and what you can do today, whether you're a senior caregiver or whether you're somebody living with Parkinson's disease. So all of this loss, so what? I always say, you have to stay engaged with right now, the here and now. Who am I today? What can I do today? What can I get in today? And how am I doing today? All right? Let the past go. Settle with the past and say goodbye, right? And engage here and really believe in tomorrow, that you're going to be doing it tomorrow. So saying that, apathy is a part of this disease. What does apathy mean?
You just don't care about anything.
Yeah, you got the blahs. You got the what's the word that I want to use? You just don't have the. That's a good word. You're kind of disconnected. Oh, that recliner looks really good to me. I think I'll get it in and stay there. Okay? It's just easier to do nothing. All right? Now, with Parkinson's disease, the slowness that you're living with, it's not only in your physical function, it's also in your thinking and the way that your brain is working. This slows you mentally as well as physically. So the one thing, that we say, you're not going to be apathetic if you have a sense of impulsivity, right? You can do it easily, you can do it in a hurry. Oh, I think I'm going to do this. So bada bing, bada boom, you do it. You're up, you're done, you're dressed, you got everything you need, you grab the car keys, out the door you go, you do it, and then you come back again, right? Well, for the Parkinson folks, they lose that impulsivity. It takes so much time and energy to get ready to do the task, am I right? That slows you down a little bit. Time, energy, slows you down. And then you have to wait for, do I have somebody to drive me? Do I have somebody to help me? I want to do this, but I have to wait until somebody can help me with my buttons, right? So you lose the sense of impulsivity, which slows you down even more. And when you start thinking about everything you got to do what you want to do, what happens? You get tired thinking about it. You get overwhelmed, and you can rationalize. I'm just going to stay here, my jammies. It's easier, isn't it? It's a reality. All right? Apathy is horrible for you because it's very important for you to stay up and dressed and engaged. And with apathy, you slow down your body, your mind, you become dormant, right? You're not out being the interactivity, the interaction, the stimulation. Parkinson patients, any senior, we need stimulation. Right? We need to be stimulated by even a simple conversation is going to keep you up and talking and your brain working. Parkinson patients, even people that stay isolated at home, that TV's not talking to you. That's a one-way street. That contributes to apathy because you can sit there like, right? The dog's no stimulation either because he's just unconditional, hi, I'm here. All right? Am I right so far? This is how I think, all right? You need to be up and out and stimulated and engaged. Now, you have to work at avoiding apathy daily because once you get into that apathy mode, you're going to stay there. So it's easier to stay out of it than it is to get yourself out of it. You with me? So that's what I'm saying to you every single day. It's why conversation matters. It's why getting up and getting dressed and getting out matters. It's why I don't care if you're even walking around, here I go again, Publix with the colors and the lights and the conversation. It's this outside stimulus that you have to have. It's why this place, I always have something going. You know, that you have an opportunity to move, to listen, to trigger an outside stimulation. All right? You have to avoid apathy. You have to work at it every single day. All right? Now, if you're having a downtime, if you're having a time that you're not feeling great, if you have a time that you're dealing with a personal challenge, absolutely, I respect you enough that you need some private time, that you need some quiet time, that you need some downtime. If you're dealing with a concern with your family, if you're dealing with a concern for your health or something like that, if you have a worry, that's okay. You can take a couple days off, but you will not make it a lifestyle. The worst place for a Parkinson patient is to be in the recliner. I call it belly up in the recliner. I got rid of my recliner. You know that recliner that I told you? It's gone.
Good.
I got rid of it. I gave it to my daughter. It was not easy. I had this great Scandinavian recliner. It was really beautiful. It was like this color. And when I would go home at night, it would call my name, Marilyn. and the other house, the old house. And if I got in it, I never got out. So I never got in it until I was ready to stay there to get out to go to bed, all right? But now it's gone. I avoided my temptation. Pretty good, huh?
Right.
What?
A big component to this whole thing is attitude. You have to have the right attitude, or you're not gonna
That's it, Pete.
do anything.
And what attitude is that? What attitude? If I went around the room and said to you right now, what's your attitude about living life with Parkinson's? Positive. I can. I will. I will. I will. You have to have, and this is empowerment. Okay, now you have to understand, attitude is everything. If you don't have a positive, confident attitude, you might as well get on your gray shabby bathrobe and get in your recliner or get in bed in a ball and stay there. All right? Motivation comes from where? From the outside. I'm your motivation. I'm outside of you, hugging you, kissing you, motivating you, telling you you can. Okay? Motivation comes from out here. All right? Where does the empowerment come from? I can motivate and motivate and motivate and motivate. Talk to you, do it. But until you buy what I'm selling, and until you put what I'm telling you into motion, until you own it and believe it and do it, there is your empowerment. You're empowered. And you have to understand, because I know this to be true, everything that you need to live well with Parkinson's is inside of you. You have to know it. The good Lord put it in there. All right? It's in there. You have the intelligence, you have the courage, you have the strength, because through my eyes, you live here. You live in your head. You got me? This is where your attitude is. You live in your head. If your body isn't working today, all right, if you can't do the two-step, right? Or if you can't be a scratch golfer anymore, you live in your head that my life is wonderful and I can do what I want to do and I'm happy and I'm positive and I'm blessed, okay? If this old body is conking out, or if it's not obeying you, there's not a whole lot we can do about that. But in your head, you can live and live well. How many of you are doing that? You can dance and never get up out of your chair. Where do you dance? You dance in your head.
Doing the bar stool boogie.
Or the bar stool boogie. Leave it to Pete. We could do a line of bar stools, right? We can dance sitting down. You can dance laying down, right? So realize that if you have that empowerment coming from your head, and it will be, not I think I can, I will. I will get up. I will get dressed. I will try. Okay? Now, all that comes from I accept who I am. You know, if you don't accept who you are today, you're living an exercise in futility. You're never going to be happy. You're never going to have peace of mind unless you can say, I am who I am, and I think I'm terrific just the way that I am. How many of you have done that? It's very important with living well with Parkinson's, that you can say, well, maybe I could be better, but I'm not. Who cares? All right. And maybe if I didn't have this disease, I could do that, but I can't. So let that go as well. All right. But always go back to the knowledge, the belief, you know, that everything that makes you extraordinary is still there. There is no disease out there, none of them, that can change the wonderful qualities inside a human being. The wonderful qualities that make you lovable, or that make you who you are, or that define your personality, or that make you matter in the world that you live in. Are you with me with that? You know, the wonderful qualities that you have that make you loved and respected and dignified as a human being, nobody can touch that. Nothing. All right? Unless you let it. You know, how you feel, how you respond, is up to you. And you can only let the disease or other people or anything else hurt you, harm you, or change the way you think if you allow it. So there's your control over Parkinson's disease. That goes back to my simple thing. You have Parkinson's, what's the rest of it? All right, there's your tagline. Let's put it again in the newsletter for the trillionth time. All right. You have Parkinson's. Parkinson's does not have you. A huge difference. And that's the meat you hold on to. Okay? Now, apathy means I'm up, I'm moving. If you say to me, Myra, it's too hard to get up and do it, I'm going to say to you what? Allow more time, ask for more help, make more plans, to do it. Do it in advance, but do it. So watch with your apathy, all right? Because apathy leads into what? Depression. What's depression? Depression we talked about. You're down here, you're blue. Now, it's a clinical depression. It's a chemical imbalance in the brain. It's not emotional, okay? It's not mental. It's a chemical imbalance in the brain. It comes along with the disease. You go down, you're low, you're blue. Standard, they'll say for more than 3 weeks. 3 weeks scares me. So I teach 2 weeks. Actually, I start saying if you're down here for more than 3 days, you better wake up because something's going on. And if you don't have a trigger for it, now sometimes you can just be tired. Sometimes you can just be fatigued. Sometimes there's an underlying whatever, okay? Sometimes when you're pushing, and the pressure is off, okay? You can fall into a little bit of a, But if you're down here and you're feeling sad and blue and low for more than 3 weeks, you're in trouble. Now, what are the signs and symptoms of depression?
Not getting out of bed.
Yeah, the number one is what? The number one symptom of depression is what? It's all part of it. Keep coming. Think. These are all symptoms. You're all right. Isolation. When you're depressed, you don't want to go out. Right? You don't want to go out. You're in what I call in bed in a ball. You know what I'm saying? When you're sad or you're sick, what do? You go to bed in a fetal position, right? It's an automatic response. What do you do when you have a tummy ache? What do you do when you're sick? Where do you go? You go to bed. You're laying out like this? You're like this, right? Back to fetal position, all right? I figured this out, all right? So I call it bed in a ball. Like the little one when it's still in mommy, nice, safe, sound, and warm. You're like this, all cozy. Then they bring you out and they swaddle you. Did you know they swaddle newborns? It took me the whole time my daughter was in the hospital to figure out how to swaddle this thing, and I kept saying to them, everything's high tech. Baby was born in Orlando. Everything is high tech. And I had this 12-year-old nurse teaching that a nurse how to swaddle. And I said, why are we doing this? Because all my kids ended up terrific, and I never swaddled any of them. But, you tuck and you turn and you flip and you... So the poor little munchkins, he's in here like, here, the only thing showing its little mouth. And then they put the bonnet on, so swaddling.
Mikey would have been 5'9".
Yeah, Mikey would have been 5'9" if I'd swaddled him. Mwah. Okay, but you don't want to be in bed in a ball. You don't want to be depressed. You want to be up and out and engaged, all right? So isolation, because you know what? It takes energy and enthusiasm to wake up every day with the motivation to say, I'm going to get up, and I'm going to get out of this bed, I'm going to get dressed, I'm going to do my best to look my best, right? I'm going to eat healthy food. I'm going to get a smile on my face. And then I'm going to go to Parkinson Place and talk to 3,500 people. Right? Does that take energy? Does that take positivity? Okay. So is it easier to stay home if you're depressed? Yeah. Okay. Isolation is the worst thing for you. Engagement, people with you, people around you, stimulate. The lights on, the sounds, everything is good for you. All right, now what else have I got going on with depression? These are red flags. If you have one, some, or all of them, you're going to call the doctor right away. Or
Out of your PJs.
Yeah, get up and get dressed. Your grooming starts to slip. You have to watch seniors, particularly if seniors are home living alone and they're not stimulated about how they look. All right? The grooming goes down. They don't care what they look like. You know, seniors will bathe and groom daily with no excuses, with clean clothes. I always say, my caregivers, if you're caring for someone that needs help grooming, you will maintain that human being on the same level of dignity and appearance, on the same level that they were when they lived without the disease or disability that they are living with. You understanding me? Okay. I don't want to see soiled shirts. I don't want to see things that aren't pressed. I don't want to see any of that. All right? Because the better you look, the more confidence you feel, the more positive that you feel about it. Shaving, all right? Clean hair, clean nails, all of it matters. So, but people that are depressed, they don't care about that. They just simply don't care about looking their best. What else? Loss of appetite. You have eating disorders when you're depressed. You can have you don't want to eat anything, or guess what else could happen? Feeding frenzy. You'll eat anything that's not nailed down. A lot of grossly morbidly obese, I'm talking grossly, not a little bit of overweight, I'm talking grossly overweight people, they usually have an underlying sense of a depressed state. Why? Because food is what? An automatic reward. It's a you know, if you're depressed, you're not happy. If you're happy-go-lucky and everything's great, are you depressed? You're usually depressed because there's something in your life that's dragging you down, physically or emotionally. So when you pop that Snicker in your mouth, what happens?
Ready to go.
Because it goes back to the oral phase. You got a trillion little sensors here on the tongue, and they're whole happy sensors when you put usually something naughty in your mouth, like high salt, high fats, you know, all the good stuff. That's my girl. All the good stuff goes on there. I am so happy now for a minute.
Then you gotta have something else.
And then actually it'll trigger the depressed state when the sugar wears off, all right? So you have eating disorders. You also have sleeping disorders. When you're depressed, sometimes you're sleeping too much, you know, and this is very difficult for Parkinson patients because we're trying to get you on sleep health anyway. We're trying to get you on a sleep pattern that's going to allow you adequate rest, that's going to allow you to stay awake after dinner so you can go to bed, so that you can wake up and go to sleep the same time every single day. That's your sleep health that I want for you, okay? Sometimes people that are very depressed, they don't sleep at all. And I don't want this for you either. So depression for the Parkinson patient is no. Depression also kicks in huge with caregivers because of the burdens that they carry. All right? Now, the one thing that you have to be careful of is the number one trigger for depression is what? You know this answer. Tell it to me, please. Stress. Stress is the number one thing in your life that I work all the time to keep at a healthy level with you, okay? Stress opens the door for depression, and apathy is a whole other thing coming in as well. But if you're stressed in unhealthy level, and living with Parkinson is terribly stressful, all right? Caring for someone you love around the clock 24/7 is very, very, very stressful. Okay, so we have to monitor the stress. That'll feed to the depression. Apathy will feed to depression, all right? Because you want to be positive and active and happy, okay? So how do you avoid? What are the tips and tools I'm sending you home with? How do you avoid apathy?
Keep in touch with people.
You stay in touch with people. You must stay engaged in life. And life is not going to come at you and say, oh, please come with me today. You hear me? I want you to surround yourself with good, positive people, with people that are there for you through thick and through thin. You with me? People will say, okay, come on. Now, I don't expect them to drag you kicking and screaming. All right? You can only do so much. My caregivers. All right? You make a plan in advance. You can take a plan the week, if you can, to have enough things in the course of that Monday through Sunday that you have a reasonable entertainment and activity events on that calendar. All right? So if you're coming to see Dr. Madden on Monday, I know you're up and out and dressed. You're here. You got to be here. You got to be on time. You got to show up. You got to talk. Uh-huh.
I think keeping up with friends is kind of difficult sometimes.
Keeping up with friends is difficult, and it can be very, very hurtful, right? Because, people have their own lifestyle, and there is a time that you fit in. You're the foursome, okay? You can do this, you can do that, you can boat, you can play tennis, you can go to dinner, you can walk St. Armand's and all this kind of things. Now, sometimes along the way, whether you become a senior or whether you have certain physical limitations or mental limitations, you don't fit into that group so well anymore, do you? You don't fit in so well. Or you can't keep up the high-end conversation at the dinner party, okay? So people will start to lose interest. How's that make you feel?
Bad.
Well, it's bad, but life changes. Life changes even at best, right? So you have to surround yourself, you have to pick and choose people that share your experience, right? That share your experience. It doesn't mean that people love you any less, because I think most people in life are loving, good people. There's a couple out there, you know what I'm saying, that aren't so hot. But the average human being loves you and wants to help you, but you just don't fit in. And they're not going to call and say, dinner party, second Saturday of every month, okay? So, accept sometimes that things change. Things change when you're not living with Parkinson's, right?
Right.
I've run with certain crowds for certain people. At time, my interests changed. I focus on my interests, my concerns, not my interests, but my passions, how I choose to spend my life, my family. I choose where I spend my time away from Parkinson Place. You choose it too. But surround yourself with good people that are there just because they want to be there. Surround yourself with positive people. If you have Mr. Sourpuss or Mrs. Doom and Gloom, lose them. The people that suck the air right out of the room, and we all know they live on this planet. You see them coming, and you're like, oh. I have crossed the street many times if I've seen one coming. Okay? You want people in your life that are enthusiastic, that are motivational, that are true, faithful, loving friends. They are your rocks, okay? They are your rocks, okay? I hope you found a lot of them here.